the nation as of yesterday by the Health Minister, Dr. Zweli Mkhize. This means that our province has 42% of all confirmed COVID-19 cases in South Africa. We have also lost 3 of our residents in this battle against COVID-19, and I would like to take this opportunity to convey our condolences to their families. We are deeply touched as the people of the province and the provincial government, and we wish the families healing at this difficult time as they mourn the passing of their loved ones. Now, being an epicenter of COVID-19 in our country imposes a burden of responsibility on us as a province. We have a heavy burden of responsibility on our shoulders. We must lead the fight against this invisible enemy and have to work with all sectors, leaders in various sectors of our communities, various sectors of the population in our province, to save life and contain the spread and the impact of COVID-19 on the people and the economy of our province. Consequently, the provincial government has been working in partnership with municipalities and various sectors of the population to enforce the lockdown measures, and in many areas also mitigate the negative impact of the lockdown on various, particularly the most vulnerable sections of our population. We will therefore also give you an update on how many people we have been reaching throughout the province, especially in the last 7 days, with food relief and other kinds of support. And this we have done in partnership with businesses that have generously donated, and NGOs and civil society players who have gone out there to communities to provide a number of supplies, which include food, sanitizers, and soap, and in some instances, even blankets, because we are heading for winter. And we must say that as we face winter, we are also worried about what normally happens in winter. A lot of our people get cold and influenza. And in the face of COVID-19, this can be a very tough winter we are going to face. Consequently, the provincial government has undertaken tasks, and one of those tasks is that we now have 8,005 community healthcare workers who have been trained. A week ago, we said we had already trained 4,000. We have doubled the number. So we will soon reach all our community health workers. We have 9,000 community health workers. We have now trained 8,005. That is 8,005. 8,005. We also have 607 health professionals that are involved together with these community health workers in tracing contacts and in conducting screening and testing. We want to give you an update that since the 31st of March, when the President made an announcement just a day or so before, that we need to upscale screening and testing. Since that time in Gauteng, Since the 31st of March, we have screened 26,841 people. Out of these people who were screened, 440 displayed symptoms and were therefore referred for testing and were indeed tested. Dr. Masuku will explain later the relationship between screening and testing and tracing. So having screened that number since the 31st of March, we also identified this intensive campaign of screening and testing. We identified where we should launch it, and we launched it in Stwetla, in Alexandra, on the 31st of March, wherein we screened 1,693 people right there in Alexandra, in Stwetla. And out of the 1,693, 201 were tested. Again, when Dr. Masuku speaks, he will explain the relationship between starting first with screening to identify symptoms and then putting people to testing. So in Stwetla, our health professionals tested 201 people, and only one person tested positive, and that person is now in quarantine. We thank the people of Stwetla for coming out on that day and for volunteering themselves for testing and for screening. It wasn't easy. Many of the people there we interacted with came to the fore and said they would love to know their status. We know that Stwetla is the area where one case of someone who tested positive interacted with a lot of people before that person left for the province of Limpopo. So we are very happy that the community of Stwetla cooperated with us, and that we know we are going to continue to work with that community. In fact, there's since been a follow-up by our health professionals. They went back to Stwetla after we did the test, because we want to continue to provide medical surveillance of that area. If we find that an area may have been exposed to risk, even after testing, our health professionals will continue to provide medical surveillance to ensure that we are not surprised by any other new developments in that area. The screening and testing campaign has now been rolled to all 5 districts of Gauteng. It is 2 districts and 3 metros, but using what is called the district model, we now call all of them districts. So our health professionals have gone to Johannesburg, Tshwane, Ekurhuleni, Sedibeng, and the West Rand. And in those areas, there's a specific target. They are not going to every community indiscriminately at this phase of our screening and testing campaign, but they target high-density contacts. If there's an area, through the work that we have been doing of mapping where the people who are positive are, and mapping where the largest number of contacts or people they came into contact with are, we map that, and the deployment of the screening and testing teams that are led by our health professionals are also directed towards the areas where there's high density of contacts. And this may be a suburb, or it may be a township or an informal settlement. But the screening teams and testing teams are also going to areas of high vulnerability. There are communities where there may not be contacts, but using a multiplicity of factors that we identify to look at vulnerability, the screening teams also go to those communities. And I must say that so far the screening teams have been to communities that are for those who are relatively well off and for those who are poor. I know particularly in a region where the screening team went to a suburb. In terms of the regional breakdown, I also want to say that from now on, we will, on a day-to-day basis, give the breakdown of these 5 districts in Gauteng. When the numbers are coming, and we wait for the numbers from the Minister of Health, he is the only one who's got the authority to announce the numbers on a day-to-day basis. We wait for that, and once the numbers are announced, we do a breakdown region by region in our province. So far, in terms of those cases of people who have tested positive, as of the 8th of April, and these numbers would hopefully, or normally as we do, will change this evening when the minister releases new ones. Johannesburg is the epicenter of COVID-19 in Gauteng. So if Gauteng is the epicenter of COVID-19 in the Republic, Johannesburg is the epicenter of COVID-19 in Gauteng, with 440 cases, followed by Ekurhuleni with 111 cases, Tshwane with 90 cases, West Rand with 12 cases, Sidibeng with 6 cases. Now we have an additional 123 cases that are called unallocated. I would like Dr. Masuku to explain, as a medical practitioner, what these unallocated cases are, because we have a complex of institutions in Gauteng. We've got public laboratories that do tests. We also have private laboratories that do tests. So when we do reconciliation of the numbers and get confirmation from the NICD, the National Institute of Communicable Diseases, look at all those, and we always able to reduce the number. On a day-to-day basis, the number of unallocated gets reduced, but Dr. Masuku will explain. So we are certain that those are people in Gauteng, but there may be a question about in which of our 5 districts they live. We also want to report that we have improved and enhanced our capacity to trace contacts using technology. And so far, we have been able to trace 90% of all contacts. Now, this is very important because COVID-19 spread on the basis of people who have come into contact with those who have coronavirus. And some may have symptoms and others may be asymptomatic. So being able to trace those who have come into contact with those who have tested positive is one of the key things that the world, all countries, all jurisdictions are battling with this, that the capacity to trace all the people who may have come into contact with someone who have tested positive. It's very, very important in order to cap the spread of COVID-19. So as I say, so far we are happy. We hope we will improve above 90% in tracing all contacts. As we continue so far we are using our own technology. There is a national process to help us deploy additional technology to be able to do medical surveillance of those who are positive and who they may have come into contact with, as a measure of ensuring that we encircle particular localities where people who may be positive may have had contact with many more people. So this is a very important area of work. We will continue to increase our capacity to track down contacts and reduce the number of contacts that we have not been able to trace until we have traced everybody. We are also we have introduced self-screening feature on the Impilo app of our provincial health department. That application is very, very important. And we would urge all those who have handsets, who would really, really want to use technology to communicate with us, to use the Impilo app. Is now having a self-screening feature to ensure that there's seamlessness and easy screening by the public, including self-screening. And we will be able to get that information immediately and communicate relevantly with those that we think after self-screening need to be tested. Our tracers have been very good at using this app to monitor contacts also in many different parts of our province, working with our tracing teams who have developed an algorithm for screening, testing, and following up with various patients who are arriving at different testing sites. I also want to report on a very important matter that Gauteng province has currently been paying attention to PPE, personal protective clothing, for healthcare workers. And as we speak now, we have adequate supply of personal protective clothing for our healthcare workers. And we emphasize that they are our priority for personal protective clothing. They are the priority, the number one priority. Of course, even other workers, including those in the security services who are working very hard, are also our priority. But we start with the healthcare workers first. We have been interacting with the trade unions in the public service in Gauteng. This is a matter that the trade unions have been highlighting. We have met with them as the Gauteng provincial government, led by two MECs, the MEC for Health, Dr. Bandile Masuku, and MEC Jacob Mamabulo, who is the main person on behalf of our executive council who liaises with the trade unions in our province. We have briefed the trade unions about our work, including on getting more and more personal protective equipment, and they expressed their full support for the measures that the provincial government is putting in place, including in protecting more workers. The provincial government is also continuing to do work in order to increase the number of beds, particularly for COVID-19. We are looking at lots of our existing facilities, and that work is at a very advanced stage right now. In some of our existing healthcare facilities, we are clearing certain sections of the hospitals, and in other instances, identifying a hospital where we may need in fact, where we are preparing to move patients to another hospital so that that hospital is cleared completely for COVID-19 patients. We are also working with the private sector. We are identifying additional beds as we speak. Our team is at a stage of finalizing this to know how many additional beds we will get from the private sector for all different purposes. Some of the beds are for hospitalization, high care, and ICU. Others are also for quarantine. The quarantine beds would not be in our hospitals. We are working with our municipalities. We have identified various facilities across Gauteng where, should we have more people, especially in communities, high-density communities, should we have more people who need to be quarantined, taken out of their communities for a specified period in accordance with the advice of our medical specialists. It's usually 14 days. We know now how many beds we have in Ekurhuleni, in Johannesburg, in Tshwane, in Sidibeng, and in the West Rand. This is work in progress. Some facilities, especially for hospitalization, some facilities require significant amount of conversion to repurpose them into what they would be able to do, particularly should we reach a stage where we have more cases of people who need to be hospitalized. Dr. Masuku will also give some information, share some information about how many people so far have been hospitalized in Gauteng province. This is the information we would like to continue to share, but we do not want to be sharing information around suburbs and specific townships, which information is important for our medical teams and our health professionals. We do so because we think it's enough to aggregate at the district level. We have already experienced problems of stigmatization of individuals in communities, in localities who had tested COVID positive, including those who have recovered. So we have several cases of stigmatization and we want to make sure that our healthcare professionals use their protocols to protect those who may have tested positive as they are going through the various stages of recovery. So it's very important that the information about specific localities is used for purposes of preventing COVID-19 spread and not for other things. That information is in the hands of the authorities, especially our healthcare professionals, the team that is led by the MEC for Health, Dr. Bandile Masuku, and the HOD, Professor Lukele. It's a very capable team. I am very confident as the Premier of Gauteng that the fight against COVID-19 in Gauteng is led by healthcare professionals right up to the level of the MEC for Health and the head of department and all the clinicians around them and the various categories of healthcare professionals. They give us briefings, they give us advice. We are able to make decisions very confident that we are given advice by specialists and scientists to make the right political decisions. We also want to say to you that the lockdown has helped us in the following area. OR Tambo was a big area of concern for us. A lot of people who were arriving in flights from different places of across the world, including countries that are at great risk, were arriving through OR Tambo. So since the lockdown, particularly including the lockdown of OR Tambo and Lanseria Airport, we have been finding that the work of our tracing teams is very focused now. There are no new numbers coming. We also want to say even the closure of the borders into our country, that has helped us a lot. Gauteng is the economic hub. OR Tambo is the aviation hub of sub-Saharan Africa. The closure of OR Tambo and the closure of the borders, the many borders across the Republic, of many of the people who come through those borders end up in Gauteng. That decision linked to the lockdown has helped us a lot. At this stage, I would like to give a briefing about the work that the provincial government has been doing with regard to providing food to the food insecure and vulnerable communities in Gauteng. I would like to start by thanking all the NGOs and the business people who have been working with us as social partners for helping us to reach, at least since the national lockdown, we have reached 15,000 households that are food insecure. Now, not 15,000 people, 15,000 households that are food insecure. This excludes the homeless people. We have reached them through the work that's being done by civil society, the NGOs, the businesses that are donating, as well as our social development department food security program. We have been together, we have been able to feed more than 60,000 people, and at this stage, excluding the homeless people. If we include the number of homeless people that we have been able to reach, put in various shelters, provide them with food and sanitizers, the number will be much more. And we are consolidating that number. The category of the homeless people is a separate category. And then we have other households, particularly in the areas of our province that are regarded as most poor or poverty-stricken areas. Those areas are Sidibeng in the south of Gauteng, West Rand, which is the western corridor of our province, and some communities in the 3 metros. Communities in the north of Tshwane, up to Winterveld and Hammanskraal, and communities in the far east and north of Ekurhuleni, and communities in the south of Johannesburg, and in the south and the northern areas of Johannesburg. So we've got a lot of the people who are food insecure and vulnerable in there. In the next week, we are going to increase our capacity to reach more households. Emisili Sufi is leading this effort to ensure that we can reach as many people who are food insecure in our province as possible. But we know there are many more people who are phoning, who are sending in messages, who are saying they need some kind of food relief. And we know that the situation may, as the lockdown reaches the 3rd week, there may be more people who will be coming to the fore. I want to continue to call on business people and civil society groups, including the churches that are supporting these initiatives, and various religious denominations and organizations linked to the faith-based sector. Many of them across all religions are working very, very hard with us to make sure we provide for the needy and most vulnerable in our communities. It's also important to indicate that there are several initiatives to continue to encourage our children, the learners at home, to continue doing homework, schoolwork from home. We announced the partnerships we have with various broadcasters who are helping to bring content at home to as many of our learners as possible, using various digital platforms that we have. Just speaking on education, we are very, very concerned. We are perturbed. We are more than concerned. We are perturbed by the targeting of schools by criminals in our communities. So far, 22 schools in Gauteng have experienced either break-ins, including the 4 that have been burnt down in the northern areas of our province. We have asked the law enforcement agencies, as they do all the other work that they are doing, to set up a special team that must help us trace these criminals, heartless criminals, who are breaking into our schools and helping themselves with valuable, including the gadgets, technological gadgets that we have put in many of our schools to enhance teaching and learning. I spoke to the provincial commissioner of the police, who has assured me that there is a team that is hunting down these criminal elements. In some areas, this burning down of schools is linked to people who have been disrupting projects. Some of them call themselves business forums, and we have said again and again, we work with business forums. We work with local business people who need to be supported, but criminal elements are criminal elements, and they must be dealt with as such. So the law enforcement agencies are hunting down the perpetrators of these heinous acts, and we hope there will be results very, very soon. The provincial government has also been doing work on the economy to just quantify the possible impact of COVID-19 on the Gauteng economy. We have completed that work. We have assessed all the various sectors of our economy, the major sectors of our economy that have got global, that are linked to global value chains, as well as small businesses in our townships. We have done a full assessment. We understand that the tough decisions that our national leadership had to take to carry the nation with will also impact on our economy. We also know that the downgrade that has happened recently adds to the economic woes. But as a province, which is the hub of South Africa's economy, we are also working with national government to, firstly, to help the businesses that are located in Gauteng to access some of the assistance that has been introduced by various national departments. But our big concern is on small businesses, particularly those that are located in our townships. So we are finalizing some of the concrete proposals. We will feed those concrete proposals into the national process when we have a discussion at a national level. But if there's something that provincial government would not sit back and watch, is particularly the township businesses that have been doing a lot of work. Some of them, in fact, are also coming to the fore now. Many of them are saying they are able to contribute to some of the needs of this public health emergency that we are facing. And we're encouraging those businesses in the townships that are able to supply sanitizers, to supply masks, and PPE in general, to also be able to come to the fore and work with us. We are looking at additional interventions. We are talking to the SMME Fund, which was established by the CEO initiative. We are also talking to them to see how we can work together with them to direct particular forms of support, particularly to businesses that are not likely to get funding from banks and other huge initiatives. We're also working with the Department of Small Business Development in this regard. We want to continue to support the public health system in our province, including talking to the manufacturers in our province. We are an economy that has got advanced manufacturing capabilities. We have been talking to those that can manufacture more sanitizers away from what they may have been doing before, including manufacturing ventilators. In this regard, we are working also with the Department of Trade and Industry at a national level. But a lot of these businesses located in Gauteng have expressed interest in stopping what they were doing because the lockdown says you can't do that. Some of them have identified conversion of manufacturing what may be needed by the current public health emergency. I would like at this point to say that we also have stepped up law enforcement across the different parts of our province. Law enforcement agencies are on the roads. They are conducting roadblocks on major roads, even on secondary roads on a day-to-day basis. When the lockdown first started, we were not happy with that work. People who are violating the regulations on a day-to-day basis are facing arrest. And we're saying to our law enforcement agencies, they should do their work. We cannot miss out expressing appreciation to millions of the people of Gauteng who have been observing the lockdown. We know there was a period during the payment of grants where too many people were crowding around the pay points and shopping malls. But we can see a lot of progress at the moment on a day-to-day basis. And we want to continue to urge our millions of our people that it's in their best interest, it's in their own interest to adhere to social distancing measures, hygiene measures, and that's why we want to reach as many people as we are able to throughout the province with the necessary supplies of sanitizers as well as soap. Lastly, we have improved significantly in providing water to various communities in Gauteng. Yesterday, when I spoke to all the mayors, we do that every week with all the mayors, we have been able to reach many different areas of Gauteng where there have been serious problems with water supply. And these water tanks we are getting from our national government, the Departments of Water and Sanitation. And I want to say we will be able to reach every community in Gauteng to provide, at least through tanks, water tanks, where there's no other sources of water. We will provide this working with our national government. I want to thank all the health professionals who have been doing tremendous work across our province, the security officers, our police, our traffic officers, our soldiers who have been working very well. And one thing I particularly want to say is that in the last few weeks, few days, there's been improvement. we haven't been seeing images of abuse of the lockdown by our state security agencies. We work with them very closely. Yes, they get the message from national government, from the national ministers and the president, but they also get the message from us, our metro police, our traffic officers, our police service officers, and our soldiers are responding well. They are able to respond well to the need not to abuse the authority that they have, but to enforce the regulations fairly and firmly without abusing the powers that they have. I want to call on the people of our province to continue to help us because we are very, very far from flattening the curve. We want to join the Minister of Health, Dr. Mkhize, in restating that we shouldn't think we are over it yet. We should prepare for the worst and hope for the best. Everything we are doing, we don't want complacency. We don't want to start celebrating. We must continue to work. One of the things that worries us is beyond the lockdown. There are going to be a lot of people who are going to be coming back into Gauteng province. We are worried about that. We are already planning about that so that the management system we have put into place at the moment for screening, for testing, for tracing contacts should not be overrun at that time. So we have measures that we are already putting in place to ensure that we continue with these efforts. It's too early. We must continue to work hard because we don't know when we will reach the peak. So thank you very much for being able to give us an opportunity to do this briefing. I would like us to give particularly Dr. Masuku an opportunity to explain a few things as a medical practitioner. And we can take questions. MEC Lisufi and MEC Mazbuko will be able to answer questions that have to do with their area of work, which is tremendous work. I want to thank them for the work they have been doing as part of Team Gauteng. The entire executive has been doing tremendous work under difficult conditions from where they are to support the work of our public service workers in the health services and in the security services to ensure that Gauteng province cannot slow down. We remain the epicenter, and we must do more, even in terms of screening. Those numbers are still too small. Even in terms of out of screening test, we will know who to test. We must do more in tracing. We don't want a backlog in tracing in this regard. Dr. Masuku, over to you.